So people are asking me about high cholesterol and what are the causes? Are they reversible? And what can you do about it? So oftentimes when you get your cholesterol elevated, it's really important to look at how it breaks down. So your total may be elevated, but sometimes people have a high amount of the good kind of cholesterol and not that much of an elevation in the bad cholesterol or triglycerides. So you really need to look at the total cholesterol and how it breaks down. And so HDL is considered a healthy form of cholesterol. And then you have triglycerides, and then LDL, which is considered an undesirable form of cholesterol. And you're looking at the ratio. So in a female, you ideally would like to see a ratio of the total cholesterol divided by HDL being 3.3 or less. And actually in a male, it's more like 3.4 or less. So you're looking at the ratio. And if you total up all the cholesterol, that's not the good kind, you ideally want that number to be 130 or less. And so if it's not that, what dietary factors tend to play a role with cholesterol? Well, people are often confused because you just think, okay, it's the fat and cholesterol I eat that's raising my cholesterol. Well, that plays a very small role in most people. What is normally at the root of high cholesterol that you develop, as you age, is how many carbohydrates are in your diet. And why? Because carbohydrates break down into glucose, and glucose leads to the release of insulin by the pancreas, and insulin goes to the liver and causes the liver to manufacture more LDL cholesterol and triglycerides. So the more carbs you eat, often the higher your LDL and triglycerides will go. So when you look at people with elevated cholesterol, about 85% of the time, it's how many carbs they eat and how much sugar they eat that raises the cholesterol instead of how many fats they eat. Now, about 15% of the time, it is the fat that you eat. And so if you've reduced carbohydrates, usually I would start there, reduce carbohydrates, have your cholesterol checked, see if it's changed for the better. And if it hasn't, and you happen to have like a familial history of high cholesterol, then you start looking at the fats in your diet and make sure that you're not over consuming fats. I see this sometimes in people on ketogenic diets where they just go overboard. They're doing the bulletproof coffee in the morning with the 2 tablespoons of butter and 2 tablespoons of MCT oil or something like that. And then they're doing, fat with their meals, and they're really pushing the fats. That can, in some people, lead to a high cholesterol. So even the MCT oil, I've seen it do that. So if you've reduced carbohydrates and that didn't help, then start looking at the fats and maybe start like reducing the saturated fats a little bit and even the MCT oil, and just keep retesting. You need a data drive this so you can understand for your biochemistry what is doing what is causing the high cholesterol. So then let's say you've worked on the dietary front, and of course you've incorporated exercise, you've reduced your body fat and your overall kind of weight. Then if you still need to do more, the supplement that I have found to be the most effective is red yeast rice. And, red yeast rice has the same basically ingredient as is in a statin. And I'm not a big fan of statin drugs because they have downsides. They have, they occasionally have to be used, but they do inhibit the production of coenzyme Q10. The red yeast rice seems to be better tolerated. I've never seen liver enzyme elevation, which can be a side effect from statin drugs. I have only like a couple times in 25 years of practice with thousands and thousands of patients seen any muscle soreness or anything like that. So it seems to be better tolerated, and it is very effective at lowering the cholesterol. only co-administer it with coenzyme Q10 because you want to avoid the side effects that can occur because of coenzyme Q10 depletion. But I think, if you take precautions and you use this lower dose as necessary, you will very unlikely have side effects from that. So these are things to consider, but usually you can move the needle with diet and lifestyle.